we need to try to aim for zero harm. So I think most health professionals would admit that we are probably never going to cause zero harm in the NHS. But if we don't aim for zero, then we're not working hard enough. Medication safety is my passion, and so when I was asked to get involved in this some time ago, I jumped at the chance because I believed that we did need to know a lot more about what actually happens in NHS organisations, because we very much relied on voluntary reporting in the past, and I was not convinced that that was telling us the whole story. Whilst the vast majority of what goes on in the NHS is done well and safely, there are things that do go wrong, and we all know that we need to be open about that, and we need to learn from things that go wrong. In an average hospital, 2 or 3 million doses of medicines will be given every year. So even if you're talking about 0.1% of things that might not go entirely correctly, you're talking huge numbers. Medication errors can occur at any stage within the process in the use of medicines. We use the medication safety thermometer to look at the things that are most likely to be problematic, or they focus on the things that are high risk.
I think it's good both locally and nationally to be able to standardise practice and to give us a snapshot of exactly what's happening, to make sure that we improve standards for patients, because ultimately that's what we're here to do.
By increasing reporting, we're increasing awareness, helping to reduce patient harm and making sure that we learn from these errors so that we do reduce the amount of errors in the future. I do think it is really important.
We know that humans are fallible, so humans will make mistakes. So what we're trying to do is to, where possible, if we've identified that the system is encouraging the risk of human error, then we try to change the system to remove that risk. One of the great things about the safety thermometer is it gives us some measurement, so it gives us a tool to be able to have a look on a given day, every month, to see whether or not any opportunity for error occurred, or indeed if any harm actually occurred. And then that means that if we wanted to try and change something, we would have a reliable way of knowing whether or not the change in the system actually improved the outcome. In other words, we'd get less likely to have errors and less likely to cause harm.
It's probably improved our documentation of emissions from medications. I think it's probably overall improved the standard of medication delivery and management on the ward.
The ability to measure something and then plot it on a chart is very powerful, because then you can start to see, if you're the nurses, the pharmacists and the doctors on the wards, and you can see that the national average is 15%, but you're actually working at 12% or 11%, then you know that actually compared to the average, you're actually doing quite well. And what the organisation within UHSM decided to do was that it made the medication safety thermometer part of its accreditation programme, so that we can go around and find out whether they provide good quality, safe care. And that actually fosters the idea that if they're your patients and you have an ability to affect change to reduce the number of people who have an omitted dose, then it's your responsibility.
I think it's exciting. It's nice to be part of something right at the very start of it. It makes you feel a little bit more like you're developing services and improving standards.
I believe that the safety thermometer is a really, really good way of organisations being able to look at and undoubtedly move towards less harms due to medicines.